There is a moment, quiet, invisible, painless, when the inside wall of a coronary artery tears. No alarm sounds, no warning light flashes. The first sign is often the last. And the habit that makes that moment more likely, significantly more likely after the age of 70, is something you almost certainly did earlier today. You may be doing it right now. And here is what makes this so alarming. It is not something your doctor has probably ever flagged. It is not on most cardiac risk checklists. It is ordinary. It is common. And according to the latest cardiovascular research, in older adults, it can more than double the risk of a fatal heart event. Do not go anywhere, because what I am about to tell you changes the way you think about the most passive hours of your day. I'm Dr. Alan Miller, and after 18 years treating cardiovascular risk in older adults, I've seen firsthand what happens when these warning signs go ignored. By the end of this video, you are going to understand exactly what this habit is, why it becomes exponentially more dangerous after 70, and the 5-step protocol that can measurably reduce your cardiovascular risk starting today, with no equipment, no gym, and no new medications. And I need to warn you now, the science behind this is something most people, even those who exercise regularly, have completely backwards. Here is the truth that rarely gets explained clearly enough. The average cardiology appointment lasts 12 to 15 minutes. In that window, your doctor reviews your lab work, adjusts your medications, and sends you on your way. There is simply no time to discuss the granular details of how you spend your hours. And yet it is those hours, specifically the long, unbroken sedentary ones, that researchers now know are reshaping the cardiovascular system in ways that medication cannot fully counteract. The pharmaceutical industry has no product to sell you for this. There is no pill, no supplement, no device. So the conversation rarely happens, and the habit continues, day after day, year after year. That is not your fault. The system was never designed to catch this, but the research is clear, and you deserve to know what it says. The habit is prolonged, uninterrupted sitting. And before you move on thinking you already know this, stay with me, because what the science shows specifically about adults over 70 goes far deeper than anything you have likely heard before. Let me tell you about Raymond. He was 73 when he first came to see me. Former school principal, no smoking history, maintained a reasonable diet, faithfully took his blood pressure medication every morning. By every visible measure, Raymond was doing what he was supposed to do. But Raymond also spent 10 to 12 hours a day seated, reading, watching the news, working at his computer. 8 months after I first met him, he had a mild heart attack. When we reviewed his full health picture, his sedentary pattern was a primary contributing factor. He was devastated. "But I take my medications," he said. I told him what I am about to tell you. Here is the mechanism, and this is the part that most people, including many physicians, do not fully appreciate. When you sit for extended, uninterrupted periods, blood begins to pool in the deep veins of the legs and pelvis. In a younger body, the rhythmic contraction of leg muscles during movement acts like a second pump, pushing that blood back toward the heart. But after 70, muscle mass has declined significantly, a process called sarcopenia, and that secondary pumping mechanism is far weaker than it once was. The blood thickens. Clotting factors activate, and within just 60 to 90 minutes of uninterrupted sitting, your body begins releasing what researchers call pro-inflammatory cytokines, low-grade molecular signals that sustained over months and years thicken arterial walls, reduce arterial elasticity, and critically, destabilize the fibrous caps of atherosclerotic plaques inside the coronary arteries. A destabilized plaque cap is a heart attack waiting to happen, not a gradually closing pipe, a vulnerable plaque that ruptures suddenly, triggering a clot that can block the artery within minutes. and prolonged sitting accelerates exactly the inflammatory and vascular conditions that make rupture more likely. Stay with me, because what I am about to share is the part that surprised even me when I first read it. A landmark study out of the University of Leicester followed over 7,000 adults across multiple years and found that those who sat the most had a dramatically elevated cardiovascular risk profile. And here is the critical finding: regardless of whether they exercised for an hour each day. Let me say that again clearly. Even if you walk every morning, even if you swim, even if you are physically active for a defined period of your day, long, unbroken stretches of sitting still elevate your risk independently. The exercise helps enormously, but it does not fully cancel out what 8 to 10 hours of uninterrupted sitting does to the aging cardiovascular system. This is what I call the chair paradox. You can be an active person and a dangerously sedentary one at the same time. And after 70, the biological consequences of that paradox are steeper than at any earlier stage of life. Now let me tell you about Margaret, 71 years old, retired intensive care nurse. She had actually heard about the sitting research, which is more than most people. When I explained the mechanism in detail, something clicked for her. She started setting a gentle alarm every 45 minutes. When it sounded, she walked to the kitchen and back. That was it. 20 steps, 30 seconds of movement. Nothing heroic, nothing exhausting. At her 6-month follow-up, her inflammatory markers, specifically her high-sensitivity CRP and fibrinogen levels, had both dropped into a healthier range. She looked at her results and said, "I thought it was too simple to actually work." Simple is not the same as ineffective. I have sat across from enough patients in their 70s and 80s to know that most of them are not failing to care for themselves. They are following the instructions they were given. They take their pills. They watch their salt. They try to sleep. What no one told them, what the system never had time to tell them, is that the chair they rest in every evening has been quietly working against the heart they are trying so hard to protect. That ends today, because you now know what Raymond and Margaret came to understand, and knowing it is the first half of changing it. Here is what the research supports. 5 steps you can begin today, right after this video ends. Step 1. Set a movement alarm every 40 to 50 minutes. Your phone is perfect for this. When it sounds, stand up and walk for a minimum of 2 to 3 minutes. A slow circuit around your home is enough. The goal is to break the uninterrupted sitting window before the inflammatory cascade begins. Step 2. Replace at least one seated activity each day with a standing version. Take phone calls standing. Fold laundry standing. Watch a portion of the evening news from a standing position near the television. Small substitutions accumulate into meaningful change over days and weeks. Step 3. Stay well hydrated throughout the day, at least 6 to 8 glasses of water. Properly hydrated blood is less viscous and significantly less prone to the microclotting that prolonged sitting promotes. Dehydration and long sitting are a cardiovascular combination that older adults should take seriously. Step 4. When you do sit for extended leisure, reading, television, elevate your legs slightly every 30 minutes. A footstool or a firm pillow under your ankles reduces venous pooling in the calves and lower thighs and supports better circulation without requiring you to get up every few minutes. Step 5, and this is important. Please speak with your doctor or cardiologist before making changes to any prescribed medication or treatment plan. The information in this video is educational, not a substitute for individualized medical guidance. But I would strongly encourage you to ask your cardiologist directly, how much does my daily sedentary time factor into my cardiovascular risk? Most physicians welcome that question. It signals that you are paying attention. Raymond started getting up every hour. Margaret set her kitchen alarm. Neither of them needed surgery. Neither of them needed a new prescription. They needed to understand what was happening inside their arteries and to make one simple, repeatable adjustment to their daily pattern. That is it. That is the whole story. Your heart does not need a dramatic intervention. It needs you to stand up. Now I want to hear from you in the comments below. Honestly, how many hours a day do you think you spend sitting? Most people significantly underestimate it. Leave your honest number below. And if this video gave you something valuable, please share it with someone you love who is over 70. This is the kind of information that could genuinely save a life.